What is quality improvement? Quality improvement can be described as the combined efforts of everyone that will make changes, which can lead to better patient outcomes, improved system performance, and better professional development. We believe that organizational measures that can be taken to improve quality within a healthcare organization will have the most positive impacts when compared to other techniques. Our presentation will outline three main components, such as the structure of a quality improvement team within an organization, the impact of regular meetings with members of the organization, and obtaining adequate and accurate data within the organization.
When learning about quality improvement, it's important to understand the structure of quality improvement teams. Teams should be comprised of healthcare professionals with different professional backgrounds. Teams should always maintain close communication, shared goals and objectives, strong leadership, and commitment to one another within the team. Teams should be within 5 to 15 members. Teams should look for individuals who are experienced with the problem and are exposed to the problem often. Often these individuals see the problem on a daily basis. The roles in a quality improvement team include a sponsor, a team leader, a facilitator, recorder, timekeeper, team members, and independents. The sponsor initiates the project and charters the improvement team with a team charter. This team charter can organize the team and keep the team on task while outlining main problems. The sponsor also provides improvement goals and monitors the team. The team leader coordinates the project and communicates within and outside of the team. The team leader also acts to keep the project on track. The facilitator manages discussions with questions for the group. This often keeps the discussions going. The recorder keeps track of ideas, concepts, and assignments on a written document that can be referred to later. The timekeeper keeps track of time during the meetings. Team members participate in discussions, analyze information, and share results among one another. Independents may be included in a project if they have little to no knowledge or interest in the problem. This can provide the team with a fresh perspective. Some projects may benefit from customer input as well, as it provides the team with a first-hand experience. An example of this would be a mother who had just given birth. She may be able to provide beneficial input to the team as she has a first-hand experience. In making a team, there's 4 stages of team development: forming, storming, norming, and performing. In the first stage of forming, a team determines its goals and tasks at hand. In the storming, team roles and group direction is discussed. In the norming stage, roles are finalized. Agreement of the direction of the team is finalized as well. And in performing, time is spent on the tasks at hand, and the group works to accomplish the goals determined by the group. Teams should also establish ground rules within their team members, so all members are under the same expectations.
In the first meeting, ground rules are created to make sure everyone is aware on how to communicate with each other, dealing with team conflict, creating goals, as well as creating an action plan. An action plan can be used to outline various questions the team would want to answer, such as, what is the main goal? What areas you want to improve on? What resources will be needed for the project, and what is the timeline of the project. A Gantt chart is the graph that shows the start and end dates of each step in the improvement project. By using a Gantt chart, the team can create a rough estimate to see how long it would take to finish certain parts of the project. As you can see on the left is an example of a Gantt chart that shows in the project the span of 7 months, how everything was mapped out, specifically when each meeting was going to be placed out, what each step of the process, and it showed when it was going to start, whether it was in the middle of the month, towards the end of the month, and it shows in a very detailed manner. On the right hand side, you can see there's an example of an action plan, which was used actually from the Ontario Health's action plan. In this action plan, they describe that Ontarians should have support to become healthier, faster access, stronger link to family health care, and that they should be provided the right care at the right time in the right place. In their healthcare plan, they specifically go under these three topics, and they provide subtopics such as for when they're talking about keeping Ontario healthy. One of their strategies is to implement prevention for childhood obesity, such as giving advocacy and as well as creating programs for it. There are many different tools that can be used in improvement management meetings. The three tools that are outlined in this presentation are best used at the beginning, the middle, and towards the end of the project. One of the first tools that can be used early on in the project is the cause and effect diagram, otherwise known as fishbone diagrams. Cause and effect diagrams are used to show all the possible causes and effects that occur with each part of the process. Cause and effect diagrams specifically focus on the major parts in the process, such as they are mainly being used in the beginning as they're used to outline what is the major problem. After deciding what the major problem that is being addressed in the project, the team would move on to the next tool, which is otherwise known as the process map, also called a flowchart. A flowchart is a graphical representation of a process which can be used to show the sequencing of events. Flowcharts are also used to describe the process, and by getting the team involved, the team can see what specific part of the process needs to be improved on. Such as using a standard flowchart, the team can write down each piece of the process and then also rearrange it to see what needs to be done as prioritized the most compared to what is prioritized the least. Third of all, we have another process used towards the end, which is storyboarding. A storyboard is used to show the story of the quality improvement project. The primary aim of a storyboard is to grab the audience's attention and to have the audience understand the main ideas of the story by giving only the most important information. This can be done through giving out handouts that specifically show the who, what, where, when, and why, and this can be done through illustrations or PowerPoint presentations.
A quality improvement team that is assembled effectively as explained previously will be able to collect accurate data within the organization. Information regarding quality can be used to identify various problems and trends within the organization that require attention and improvement. Collecting data is crucial for quality improvement efforts as it allows the quality improvement team to make evidence-based changes based on the specific data found within the organization. For example, while certain quality improvement measures may work for one organization, a separate organization may have completely different needs based on their specific situation. When collecting data for quality improvement efforts, both qualitative and quantitative data should be collected. Patient feedback surveys can provide the organization with the perspectives of the patients on topics such as the quality of care they received, the quality and cleanliness of the facilities, along with any concerns or requests that they may have. The organization should also seek similar feedback from the medical professionals working within the organization, as they may be able to provide insightful information on the various processes of the organization. Quantitative data regarding length of stay can help the team determine if any patients are kept in the hospital for longer than necessary and help to determine any trends or problem areas. And data regarding the success rate of various procedures and the prevalence of any unwanted outcomes can also provide insightful information. Continuous data collection can help the quality improvement team to monitor their progress on various goals that have been set and identify any trends or problem areas that need to be addressed. This will also allow them to have effective meetings as up-to-date data can be used to generate future goals and plans. Quantitative data can be used to generate various graphs and charts to observe trends and compare the actual outcomes to their ideal outcomes and goals, while qualitative data can be used to make alterations to processes, come up with new ideas, determine cause and effect, and improve patient and staff satisfaction. Data collection will also allow the organization to provide the best medical care possible. Evidence-based medicine involves the use of the best, most accurate evidence and information available to provide medical care to patients. Quality improvement strategy should also be based around the best available evidence to ensure that the desired outcomes and goals set by the team are achieved. Obtaining adequate and accurate data within the organization will allow the quality improvement team to have the most success and effectiveness. When considering the topics discussed, one could conclude that the organizational efforts taken to improve quality will have the most beneficial effects. The structure of a quality improvement team within an organization and the members included will allow for all perspectives to be understood and considered. Regular meetings with these team members will allow the team to constantly set goals and monitor progress. And gathering data specific to the organization will allow the team to identify trends and any issues while monitoring progress based on the most accurate information available.